What we really are aiming to do when we brush our teeth with the electric toothbrush or even a manual toothbrush, if that's what you're using, is to cover every surface of our teeth with the brush and make sure it's there for enough time that it cleans the plaque off. If you imagine plaque is very sticky, you can think of it like some grease on a plate. If you just kind of dip the plate into the detergent water and you pull it out, the grease is still there. You need to actually scrub it a bit with the sponge for that to come off. So it's the same with our teeth. We need to make sufficient contact of the brush with all the surfaces of our teeth because the plaque will cover every single surface, not just the front, not just the inside, not just the biting surface, but between the surfaces of the teeth as well. So teeth are not just flat square objects. So it's important that you make sure that you do the curve of each tooth because a tooth is kind of curved like this so that your brush does the front, but it also curves all around the front surface of the tooth. Because if you just hold it along the front and you don't do the curves, then that plaque will stay there and that makes you at a higher chance to get cavities between your teeth, okay? So I am going to demonstrate that action, quite exaggerated, so that you get the idea. So we go across like this, and then we go into the curves, okay? So if we're looking from the top, like this, and then as we go to the tooth behind, like that, okay? So that way we're getting right around those curves. So the next action that you want to make sure after you've done the curves is that you sufficiently cover the whole up and down surface of the tooth. So up and down. You actually want to feel the brush brushing over the gums, okay? So you should feel the brush making contact with your gum. Now, if this is something that you don't normally do and you've just started brushing like this and brushing over the gums, then you might notice a little bit of bleeding. Don't stress, that doesn't mean that you're damaging your gums at all. It's just that there's a little bit of inflammation there, and after you brush like this over the gums for a few days, then that bleeding should completely stop. If it persists, then that's a good sign to come in and see the dentist to get it checked out. Okay, the next action to keep in mind when you're brushing is to make sure that you don't scrub, okay? Now the electric toothbrush does all the action for you. It either does this or some of the sonic ones do more of an action like this. So your job is to hold the brush with sufficient pressure and sufficient time and in the right position, okay? So you don't want to be doing lots of this and quick movements. You want to be holding it and then making sure you're doing the whole up and down so it goes over the gum and doing that left and right to getting the curves, okay? So that's how you do the fronts of the teeth, all right? And then you've got to make sure that you brush the biting surfaces, which is the top and bottom of the teeth on the inside, so like this. And then you want to brush the insides, okay? So you also, that curve that's on the front of the tooth is also on the inside of the tooth. So again, and down the bottom. You really want to make sure that you can feel those bristles on the gum and you can feel the bristles getting into all the curves of the teeth, all right?